therapist, physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today's title is How to Sleep Pain-Free with Back Pain and Sciatica. This video is a part of a series of videos on sciatica. If you want to see the entire series, go to our website, bobandbrad.com, and go to the program section.
And this series has PDF printouts so that you can have a printout of each video so you can remember what you've learned.
Very good. Okay, today we're going to talk about how to sleep pain-free while you're sleeping. The big thing about how important sleep is when you have pain.
Right.
Because pain tends to wear you out physically and mentally, and you need to recharge.
Right.
So it's very important you sleep. It even helps the healing process.
Oh, absolutely.
So let's start off. We're going to give a bunch of suggestions. These are things, give it a try. See which one works for you to see if it helps you. Because we want to find that position where you can sleep pain-free.
Right.
So let's see.
And there's probably more than one, but we've come up with these over the combined of 55, 60 years of clinical experience and on ourselves.
Yeah, and this is the first one is one that Brad uses.
Oh yeah.
So
This
now you could do this with a couple pillows too, but we're going to start off with the sleep wedge. This is a good investment because they're not that expensive.
Right.
And they really do a better job than pillows.
They work a lot better than pillows, but pillows are better than nothing.
Right.
The one thing we can mention, if you do buy one, if you're tall like Bob, they make these longer here, and then it's worth getting the longer
From
ones.
here to here, they make it longer because, yeah, my legs are sitting off the edge here quite profoundly. So for whatever reason, it feels really good when you really place it,
tuck it up,
tuck it in into the
your
buttock
hips
there.
and your buttock there. I got to watch out for my mic. I guess it's going to fall out a little bit. Here, we put it over here, and then what I do is I would have the cold pack already down, but I'm going to show you because you don't want to go through all this with back pain. But you'll set the cold pack down, and you're going to lay on it. And it's best to use a nice gel one.
You're going to lie on it.
Yeah, lie on it. I've had patients try this with a hard cold pack, and it's not comfy.
Do the job, right?
You got to have a soft one. You can make them too. We have a video on how to make a cold pack with rubbing alcohol and water, and they work quite well actually too. But you place it here, and you go like this. And when I have back pain, which I do occasionally, I do silly things at home that I shouldn't be doing as far as lifting or twisting when I'm doing yard work. This is what I go to. And I'll fall asleep just like this. And typically, it feels so good. I'm very comfortable, completely pain-free. And I'll wake up about 2 hours later. I'll take the cold pack. I'll put it on the floor. And then I'll usually take this and put it on the floor. And then I'll continue to sleep. Because this all night long,
yeah,
it could work for some people, I guess, but I don't.
I think with most people, once you stay in that position, Brad, most people, they're probably going to want to switch. I'm going to take this out. They're going to want to probably switch positions in the night, just like anybody.
Yeah.
If you stay, so this probably will work for a couple hours. I wanted to show, with two pillows, you can see it just doesn't quite do the job. You're not quite as far up. I'd still try it though.
Yes.
I mean, I try a couple of those because it does put a little bit of flexion on your hips, which rotates your spine a little bit and puts it in a little different position and can help it feel better.
Right.
So
I do want to mention one more thing that's not on your list, Bob, but one thing that can be really helpful, I'm going to drop these, is sometimes if you're laying here and you just move your hips to the right or to the left an inch or two, I can have my pain go from a 3 down to a 0 just by doing a little shift like that. And I'll stay there, and it can be real helpful.
Yeah, I even think, Brad, straighten your legs out a little more. Everything that changes the arch in the back, I think, helps.
Sure.
So, like even when you're laying on your side, if you move your pelvis a little bit and change the arch in your back, can make a difference.
Yeah. Subtle little changes with back pain and sciatica can be key.
Yeah, and if you're having a kind of a flare up here, the other thing we mentioned sometimes is that you can go ahead and lay on the floor and put your feet up on the coffee table or a chair.
Right.
So you're up like that. I can grab a stool here, Brad.
Oh, actually. Sure. Yeah, so if you got a carpeted floor, it's much better. And then,
sorry, giving you a little.
Oh, yeah, thanks, Bob. You're going to goose me.
How you doing there?
Yeah, but obviously a stool doesn't work so. But a nice
Got kind of a 90-90 position here
Yep,
is what we're
a
looking
nice
at.
chair that's cushioned and that's reasonably comfortable. That's another option. It's kind of similar to the wedge, but
Yeah, obviously you can't do it in the bed very easily,
Right,
but
yeah.
that's a great thing to do if you want to lay on the floor for a little bit and take a nap. And
And use a cold pack with that too.
all right, the next thing is, this is especially true with someone that I would say that is maybe a little more ample in the buttock area, little larger curves.
Sure.
Because they have large curves, I'm going to show this on the spine, Brad.
Oh, sure.
So when you lay down flat on your back, normally you like to have a little bit of arch. You want to keep the spine straight, and you want to have a little arch in your back. Now, if you have, can you see if I have a large buttock here, that's going to hold, the spine up like this, and the spine's going to actually sag down like this.
So you need to fill in that. That's called a lumbar lordosis,
Yep.
or the arch, whatever you want to. The layman's person.
So what you can
terminology.
try is, first you could try, take a rolled up sheet or a rolled up towel. Do you want to take that one, Brad?
Oh,
And-
wrap all the way around.
Yeah, and you can wrap it all the way around you.
Yep.
And that keeps that arch when you lay on your back.
Sure.
When you lie on your back, sorry. And also, if you roll onto your side, then it's actually covering that area too, because the same thing can happen when you lie on your side. I lie on my side, and I can sag down if I have, again, kind of larger hips and wider shoulders.
Mhm.
The whole back is going to be kind of sagging here.
Right.
So I can fill in that gap with a sheet. And if you find, you pin this in place or tie it in place, or with a sheet, you can often tie it in place.
Sure.
Even. And then you lay down, and now it's got support when I'm laying on my back and on my side. Now, if you find that to be very helpful, you may want to go ahead and purchase. This is the Night Roll by
Sleep roll, I believe
Sleep
they
roll.
called it.
by Mackenzie.
Oh no, you're right. It's called the night roll. The original Mackenzie night roll.
Yeah, and so these are nice because they're made of a foam that seems to be conducive for this.
Yeah.
And you tie it around you, and it'll be in place the entire time. Then
You can see this one is too small for Bob.
Yeah.
Because it doesn't wrap. It should wrap around up about to there.
it's pretty close. It's catching me on the
Yeah.
side here, and then when I roll on my back, it's there too.
But
So
they make them in different sizes, so just size it with a chart
sure.
when you buy it.
So we'll have a link down below in case you want to check one of those out. Another thing is when you lie on your side, I'm going to lie on this side here, Brad. So when I lie on my side, one thing you may want to try, and this seems like more of a hip thing, but it actually,
Oh.
if I let I'm going to first do it without Brad.
Sure.
This is rotating my back.
Mm-hmm.
And it's putting a little bit of stress on the back. Now, that may not be a problem for someone who has a normal back, but if your back is sensitive, this might be a problem. So yeah, put a pillow between the legs, and this stops the rotation from happening. And as Brad mentioned before, try different, bringing the knees up further, putting the knees straighter, try different positions,
Sure.
or maybe even stay in one position for a while, and then as the night progresses, maybe straighten a little bit more.
Right. And I actually want to add, sometimes a pillow behind your back, if you got one of those big body pillows that are about 4 or 5 foot long, and when you have something to lean in, I know if I lay on my couch and I have some support on my back, it makes my back feel better when I do have an issue with
Sure.
my back.
That's where it's nice that, I hate the fact that you have back pain, Brad, but that's where it comes in handy, and keeps a barrier between you and your spouse too, right?
Well, yeah, in case she gets a little frisky and I'm not in the...
Brad, this is a family show.
Well, that's
All
how
right.
they start.
Next one. Let's say you have sciatica down this leg.
Sure.
This is another thing you can try. And do you want to grab another pillow, Brad? Because sometimes we go with two.
Oh, yeah.
This is an interesting trick. And you've used this. I've used this with people, and it can quite often work.
Oh,
So
I see.
they
Yeah.
lay on their side with their knees bent, their ankles together like this, and you actually put a pillow underneath the ankles and the foot, like this.
Yep. So this is, you just try it. If it
just
works,
try it.
you're gonna know it. It's
Yep.
gonna feel comfortable right away. If it doesn't, then you don't.
And some people even put as many as two, which is a lot.
You probably won't have your shoes on.
Yeah, not likely. But I would give it a shot because, and again, if it gives you relief for even an hour, that's an hour of sleep, and then try a different position
Right.
and see if that works for you. So we talked about the. Oh, we're going to go to the recliner now, Brad. If I don't know about you, but the experience I've had with a lot of back patients, they end up sleeping in the recliner,
Yeah. Yep,
and I don't like it. But some of them say they just can't sleep anywhere else.
Yeah.
And I'm not sure what's all going on there. I think some of it they like the flexion, they like the 90-90.
Right, because it's similar to the leg wedge in
It's,
certain
it's similar
aspects.
to the leg wedge, and I often have them try a leg wedge.
Sure.
I'll send one home with them even to try because. But if you're going to be in a recliner, these are the recommendations we're going to make for you. Number one, take a throw pillow.
Yeah,
And
I even tell this to people that don't have back pain so they don't develop it.
Right.
Especially if you got a soft, squishy recliner where the big hollow spot.
Yeah,
in your
you
low
should
back.
always have a throw pillow in your back recliner because this will help maintain that arch and you're not slouching. And then I want you to put it back as far as you can. I can't go back because this is not a recliner, but
Right.
I want you to go back as far as it will let you.
Yep.
So that you're at least trying to be in the reclined position.
And you'll know if the pillow's in the right spot, if it's too big or too thin. If it's too big, it's going to feel like a big bump. So you just try to get a thinner pillow.
Yeah, it goes by curves again. If you're a slighter person, I would say Brad and I are. We probably don't need as much, but I still need a throw pillow in my recliner.
Yeah.
I don't know about you.
Yeah,
But.
I use my lumbar support thing. Yeah.
And they do sell lumbar supports too, Mackenzie, that would work for that too. So.
Yep.
All right.
And we cover that in another video, I think.
Right.
Yep.
If your mattress is sagging, you might try a piece of plywood between the
box spring.
The box spring, right, above the box spring,
right,
in between the mattress.
If you can't afford to go out and buy, a better mattress, it's a temporary quick fix.
You can also put the mattress on the floor. So
yeah.
All right. Thanks for watching.
Long video.